update on this killer kennel cough that's spreading not only through my practice in Southern California, but around the country. So by way of introduction, we're going to jump right into this mystery respiratory infection as it's spreading across the U.S. We're now looking at what we're now calling atypical kennel cough. Atypical kennel cough. An atypical kennel cough will describe as we're getting into this. We're going to find out today for sure what's happening, what is kennel cough, what are the symptoms, what are the outcomes, what can we do to prevent this, and what's next. I'm going to go out on a limb before the end of our time together here today and give you my prediction of what I think is going to be happening over the next weeks and months. For sure, I'm going to be able to answer all of your questions. There should be a chat that you can put in your questions. I'll be able to look at those and review them. Probably at the end, we'll get to all your questions and make sure that everyone has the update information and all the answers that you need. So, what does the mystery infection look like? How does it spread? Is it contagious to people? Is it contagious to cats? How is it treated? How can we protect your dog and family from this infection? And all of your questions we're going to answer here as we develop this scenario that's happening around us. Months ago, late summer, early fall, northern Pacific Northwest, dogs were getting kennel cough but weren't responding to the normal treatment protocols of kennel cough. Some dogs were dying, some dogs were sick forever, and it got everybody's attention. The symptoms of classic kennel cough, well, first of all, what is kennel cough? Kennel cough is no longer what, my profession can't use the expression kennel cough. We have to use the expression CIRD, canine infectious respiratory disease complex. Whenever you hear the word complex associated with a dental disease, a veterinary disease, a people disease, it pretty much means that no one has a specific, the profession, the doctors don't have a specific handle on exactly one finite thing that it is. It's a complex. In our case, the kennel cough complex consists of 33 separate specific organisms and counting that are involved in this complex disease. And most importantly to remember, when your kid gets it, it's rarely just one of those 33. It's a combination of those 33. And when that combination starts mounting up and you get a really bad one, you can get a really sick patient. But kennel cough is infectious, it's a respiratory infection, and the disease itself is multifactorial. That's why we talk about this 33 organisms and counting. They're bacteria, they're viruses, they're mycoplasma, and the like. Influenza, for example. So, what dogs are at risk, you ask? Well, boarding kennels, doggy daycare, rescue centers, dog parties, dog birthday parties, dog events, dog shows, dog trials, dog competitions, where we take our burners and either for obedience or for confirmation. Those are risky places, even grooming parlors and the like. So what are the symptoms? The symptoms start out with a harsh, dry cough out of the blue. They make a crouping, coughing sound. If you've ever, whooping cough is a disease of people. Whooping cough is Bordetella hooperentii. One of the factors of canine kennel cough is Bordetella bronchoseptica, a close cousin. You get this loud, croupy, honking type sound. It's pretty much indistinguishable from a normal, I shouldn't say normal, but a pneumonia type cough doesn't sound like that when it starts out with. You get this loud, kennel, croupy type sound. Most clients, and it comes out of nowhere. Dogs are normal, they eat breakfast, and all of a sudden you get this crazy coughing type sound. clients are on the phone saying dog swallowed something, got something stuck in the throat, because that's exactly what it sounds like to start out. You get this retching, gagging thing. Sometimes they lose their appetite, usually not. Sometimes in the early stages, they'll get a fever, sometimes not. Sometimes they'll have an eye or nasal discharge, sometimes not. But most of the time, all the time, they have this loud, croupy cough, and many times they'll bring up this white, foamy stuff. So if the symptoms, and this is normal kennel cough, and the problem is these mystery cases start out as normal kennel cough. That's challenging. So if the symptoms progress, what happens? Well, the kid will be going from pretty normal to kind of sick. They'll be running a fever. They'll start losing their appetite. They'll get a nasal or ocular discharge. They could start having breathing problems, and their breathing could become labored. Breathing problems and labored breathings are generally associated with when the infection goes from the upper airways into the lower airways, and you start getting pneumonia. So anytime you're getting breathing problems or labored issue types like that, you need to see the vet right away. So, mitigating factors. Patients in good health are going to have a good prognosis and be less sick. Patients in poor health, not so much. Lapses in vaccinations will increase risk factors and allow the patient to be more at risk and more susceptible to getting complications and or the infection in the first place. Stress at home, stress in the environment. Temperature extremes, when the temperatures are fluctuating and the like, we see more problems with this. But humidity is a big concern. Humidity is a big concern. And that, think about, kennel cough, classic place where you're going to get it. You're going to get a kennel. Where's a kennel? Well, kennels indoors, fairly humid. Why? Whether using water almost continuously for sanitation, good idea. Sanitation's a really good idea, but that humidity creates more water droplets and more chances of the respiratory infection being transmitted. So we're seeing 3 clinical outcomes. So the normal kennel cough starts out and it's not normal, you treat it normal, and all of a sudden they're getting sick. 3 outcomes. First is mild. So they're going to have kind of a mild type issue. They'll have some inflammation in their upper airways, but in the killer kennel cough and this atypical kennel cough, instead of a 2 to 3 week duration, we're getting 6 or 8 or even up to 3 or 4 months sometimes, where they're still having symptoms and still having problems. Most of these patients can be treated as an outpatient, but they're minimally responsive to antibiotics and the standard of care that we normally provide for them. Outcome number 2, that scenario will develop into a severe pneumonia and lower airway disease. That's bad. A lot of these patients need to be hospitalized. Outcome number 3 is worse. A few of these patients will become acutely ill. They'll get acute pneumonia, and some have died in as little as 24, 36 to 48 hours. That's bad, and we need to make sure your kids don't do that. What do we know? Well, we know for sure that the limited area in the Pacific Northwest is no longer limited. It's spread to Southern California. It's spread across the country. There's cases from New York to Florida and everywhere in between. And my humble opinion, it's a matter of time before it just kind of is everywhere. The second thing that we know is that insurance companies are reporting a 50% increase in the diagnosis of pneumonia over the same period last year. In other words, if we take a period like July, August, September, October, November, 3-4 months in that early stages where there's some early statistics, insurance companies are saying there's an increase in pneumonia diagnosis over that same period in 2022. Same type of statistics are coming out of local emergency centers and referral centers around here, where locally the emergency centers are reporting an increase in pneumonia cases over last year at this same period of time. We don't get take that for what it's worth, because the insurance companies get the worst of the worst. The referral centers definitely get the worst of the worst. Less than 3% of the dog population in the United States is insured. Wrong cup of water. That fixed that. Less than 3% of the population in the United States is insured, so we can that statistic is definitely skewed. But obviously, there is more cases and more concern going on now than there were last year. What it's not is really, really important, and I think too many people are glossing over that. What it's not is this, and don't memorize this, it's not this long list of diseases: Bordetella, canine adenovirus, canine herpes virus, canine parainfluenza virus, influenza H2, both flavors of the influenza virus, mycoplasma, strep equi, and the canine pneumovirus. Why do we know that? Because all of these dogs, not all, but the vast majority of these dogs are being tested with the standard protocol. And standard protocol is to do throat swabs and send them into reference laboratories, and these are tested with basically forensic DNA type testing to look for those organisms, and they're consistently negative. I mean, you may get one here, you may get one there. There was a one shelter was reporting a huge influx in the strep equi, but that was just the one shelter, and they had their own specific problems, and strep equi can all by itself respond to antibiotics pretty well. My point is, it's not testing positive for the known pathogens that we normally see involved with the with classic kennel cough. So we're dealing with this atypical kennel cough from sources that are essentially unknown. So the second thing that we know is that the majority of these dogs are getting it in the classic environment, the kennel type environment. And so I think it's very, very, very reasonable to extrapolate that transmission is upper respiratory, droplets, and the like. Could it be transmitted by what we call fomites, which are surfaces? For example, a water bowl at a dog park? Yes. That's documented for classic kennel cough, but the incidence is very, very, very low. As far as cats are concerned, normal kennel cough, all of the viruses, strike that. Normal kennel cough, most people think cats are immune. Wrong. Normal kennel cough, kitties are susceptible to Bordetella bronchoseptica, which is the main bacteria that dogs will get. Cats are susceptible to influenza virus and several other of the viral infections, any of the bacteria possibly on a lower risk type scale. The point is, most cats, let me say it this way, there are no reported problems with cats that I'm aware of with all the research that I've been able to do, period. No reported issues with cats, period. Also, no reported issues with people. If you look at this plethora of infections that dogs can get, some of them are pathogenic to people. But classic kennel cough has never been considered a zoonosis contagious to people, primarily because of the dog harbor and the way it's transmitted and the like. But that doesn't say that we shouldn't use precautions and take good health sanitary risks if we do have a coughing dog or an issue like that in the house. So in my office, we're using, basically went to curbside protocols, screening all patients for upper respiratory infections, triaging them outside and determining whether they're at risk for having this infection, and then proceeding accordingly. For risk management, I think it's very important to pay attention to all aspects of health: good diet, good nutrition, good exercise programs. The healthier you are, the less likely you're going to have any problems with this type issue. If you do get an infection, the likelihood of recovering is higher. Go back to COVID. You don't want your 98-year-old grandmother that's getting influenza virus and COVID all at the same time. The risk factors are huge and the prognosis is really shaky. So we want to make sure we don't put our kids in that group, period. So making sure vaccinations are current, making sure health exams and everything else is current, and of course reducing exposure. Briefly, vaccinations. Everybody should have their core 4 vaccinations: distemper, adenovirus, which used to be called herpes virus, parainfluenza, and parvovirus. The world will look at those of the American Animal Hospital Association, the American Veterinary Medical Association recognize those 4 as core vaccines. Everything else is optional based upon the patient's normal risk factors and the like. In our situation, I consider Bordetella a core 5 because Bordetella is the only one of these 33 that paralyzes the respiratory cilia. What do I mean by that? The lining, the physiologic lining, the anatomic lining of the upper respiratory tract in dogs and people are tiny little cells that have hairs on them, cilia, hairs, that whisk away crud that's in the respiratory tract. They're basically the sweepers that keep you and me healthy 24/7, 365. Bordetella infections are the only one that paralyze the cilia, which means the sweepers are on strike, the garbage is building up, and the likelihood of pneumonia goes from very low or relatively low to off the scale astronomically, and you don't want that. So Bordetella, I think, is 100% critical for all patients that are doing anything but sleeping on the 5th floor of an apartment house 24/7, 365. Influenza virus, I used to reserve for just high-risk patients, the kennels and the like, but based upon our experience with the influenza outbreaks in 2015 back in Chicago, the majority of the fatalities had comorbidities. They had comorbidities. They had this problem and that problem. They had Bordetella, they had influenza, they had mycoplasma. My feeling is that if you can prevent comorbidities and just get one disease, whether it's this nasty bug or not, your kid's going to be in a lot better shape of fighting the infection and getting over it and getting healthy than the average, and then another patient that doesn't have that kind of protection. So best protection is prevention. I'm recommending social distancing to the extent possible. I don't know if I have my social distancing slide. Don't see it here. So I have a social distancing slide, which you can imagine. Dogs separate, but picture them, 2 dogs down the street, bopping down, gonna say hi, they're gonna sniff each other. Two dogs bopping down the street, they're gonna sniff each other, wow, 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 do these head circle type thing, they're gonna lick each other. There's a good place to transmit disease. So I think social distancing until this thing calms down is a really good practice, and we're going to enforce that to the extent that we can. So there was my social distancing slide. So today we talked about what's happening. We've talked about what is kennel cough, what are the symptoms that we're looking for and trying to prevent, outcomes, prevention, what's next. I'm going to go out on the limb and tell you my prediction and what I think is going on. If you're looking for a vaccine, I don't think that's going to happen. I'd like to see a vaccine. I like to see vaccines improve. But if you've got a condition that's got 33 things, we've only got five vaccines, 5 things we can prevent for now. Not likely we're going to get something. Maybe I'm being pessimistic. Those of you that know me, folks, I've been doing this for decades and decades and decades and decades. And kennel cough tends to be a seasonal thing. It's seasonal to an extent it's summer and kind of winter, associated with the times that people travel. In the summer, everybody's out of school, they're going to go on vacation. Most of the time, the four-footed family members don't go. Where do they go? They go to a boarding kennel. So the boarding kennels are full, the risk of close contact is high, and you get kennel cough. It's kind of like Christmas time, the same thing at Christmas time. Thanksgiving, Christmas, people are traveling, go away with their families, dogs go in the kennel, you get this increased risk factors. Kind of like you and I going to the mall and going shopping at Christmas. What happens? Well, you got all these people together. What's your risk of catching a cold? What's your risk of getting influenza? What's your risk of getting COVID? It's higher. So you pay your money and you take your chances. Now, every 7 years, plus or minus 1 or 2, my memory, going back decades and decades and decades and decades, my memory is that you get this killer kennel cough. You get kennel cough cases that are really bad for a period of time. Sometimes it's the summer, sometimes it's the winter. Doesn't really make any difference. And you treat them appropriately, and they get better in spite of everything that might be brewing behind the scenes. Decades and decades ago, we didn't have that fancy test for all those things. We've just had that test for maybe 5-7 years. So we're getting more information, more this and more that. Now, I feel that we're in this one of these 7-year blips, and give this infection 2 or 3 months, it's going to run its course, and everything's going to go back to normal. That's my hope and my prayer, that this isn't going to go crazy like COVID did for the better part of 2 years before we got a vaccine. I just don't see that happening. But that's not going to stop me from taking the precautions that we've talked about here today. It's not going to stop me from recommending that you take these precautions that we've talked about here today. And I'm really pleased that I could be on board and helping you get this information out. And I want to make sure that you have a good, healthy, four-footed family for the next weeks and months and years to come. Thanks for being here today, and I appreciate all of your support now and over the last few years. And we'll go to questions. All right, getting some questions that are coming through right now. Paul, good to hear your typing. My pup sniffs everywhere. How high is the risk of getting sick from sniffing? Well, it depends upon where he sniffed. So the question is, sniffing, and will sniffing increase your risk of getting this infection or possibly other disease? We'll look at that in 2 parts, actually. Number one, it depends upon who sniffed there last. If another dog with upper respiratory droplets went or slobbered on that spot, and your dog comes along and sniffs or decides to give it a good taste, there's a risk of transmitting infections. From the standpoint of respiratory viruses, I think that's pretty low. The the example with like a water bowl at the dog park, or a common, a lot of times, a lot of green belts will have water balls for the dogs to lick and sniff on. I personally try to avoid those. I'm normally carrying my own water and the like, but sometimes I don't, and I'd rather have them drink than die of thirst on a long hike. I worry about that, but not too much. The problem with sniffing in strange areas is not necessarily other dogs and other infections that might be on the droplets, but what about the gardeners? What about the chemicals? What about the fertilizer sprays? What about insect sprays? What about other type of chemicals that can be in the like? On green belts and walks, you got all those potential things. The one thing that feet, and if they step on, you're talking about sniffing, they step on the grass or the pavement and they lick their feet, they could come up with something. One of the things that I like to do when I can, when we're coming back from a walk, is I'll rinse their feet off. I mean, it's not a big deal to have a hose outside the house and turn it on and rinse their feet off before they come back in the house. Pretty simple sometimes, particularly if you're not quite sure. From the standpoint of, we have puppies from time to time, and we go to dog shows which have, to me, potentially all kinds of things. I'll use a 1 to 30 solution of bleach as a foot bath for the 2-footed people coming in and out of the vehicles of the dog show, and for the 4-footed people coming in out of the vehicles as well. So, question from LD. Glad you could join us, LD. What should we ask the question? So the question is about boarding and questions you might ask the boarding facility. You noted that they board about 15. 15 is to me, in my experience with boarding kennels, a relatively small number. I've known kennels that have well into the hundreds. So I think that's a good choice, to have one that's relatively low in the population and the like. Questions to ask would be sanitation. How often are they cleaning things? What type of disinfectants they might be using, and the like. The second thing to ask is, or investigate, is at least from the standpoint of safety, is how much from the standpoint of boarding, classic boarding is individual dogs, individual stalls. So if that's what you want, make sure that's what you're getting. Many boarding facilities now offer community exercise programs, i.e. a daycare type thing. And so you certainly want to ask if that's going to happen. If that's what you want, make sure that that's going to happen. If that's not what you want, don't become surprised and the like. But dogs that are in close contact, mouth to mouth, they're going to be at a higher risk for the infection than in isolated areas. But if you take a classic kennel picture of you, like a row of dogs, 15 in a row, or the like, not that much different between those dogs and you and I on an aircraft. If you think about it, a pressurized aircraft has one air source, and that's the whole cabin, and it's circulated through that. Since COVID, they've added, I think would be the right term, added air filtration systems and really improved the air quality on those aircraft. I think that's one advantage that we have, that outfall of COVID. So, applying that to your boarding situation, find out what type of ventilation filtering systems they have. Some kennels have a great filtering system. Some are just using normal air conditioning and the like. Paula, good to see you're typing as well. Glad you could join us here today. How long does it take after exposure will dogs show symptoms? Wanted to thank you, Paula and Daniel, want to thank you for doing this informative. Well, you're very, very welcome, Paula. Very, very welcome. Incubation, good question, very good question. Incubation, generally 3 to 7 days. Sometimes as little as 3, 5, 6 days is generally the considered the average incubation period for kennel cough. And a question from LD, how many cases I've seen? So far I've seen 2 cases of the, excuse me, other than what I have right now. I don't have kennel cough, I have dry throat. So the cases that I've seen so far have been the mild kind of chronic case where they have it, not responding to any instant get better quick fixes. Apparently they've had the infection now for a cough type problem for in the 6 to 8 week range, November 1st through middle of December, so 6 to 8 weeks. But they seem to be doing better and are at, in my opinion right now, at a low risk for pneumonia or any poor outcomes. So I think that's at least good. I had a lot of questions about cats this week, and the have not seen any cats even showing any upper respiratory infections. I'm not aware of any reports from colleagues in the emergency centers about any influx of things for cats. I don't think, cats are not doing daycare. The a number of cats boarding, I think, in the last 10 years, percentage-wise, at least in my ability to watch things, is going down and down and down. And I think one of the reasons for that is technology. There's so many, we've got automatic litter boxes, we've got automatic feeders. You can get a feeder that'll feed your kitty 3 times a day for the better part of a week. And many people choose to, depending on their risk tolerance, leave Fluffy at home with the automatic litter box, automatic feeder, and take a long weekend off. And I'm not aware of anybody having any problems. I personally worry about power failures and things like that, but that's just me. So we'll take one more sweep for questions. I want to thank everybody for your questions, and mostly I want to thank you all for caring enough about your dogs and your pets to attend something like this and take time out to educate yourself so that you can keep your 4-footed family happy and healthy. It's good to hear from you, Paula, and give Ruby a pat on the head for me, and Paul, give Samson a pat on the head for me. And here's another question scrolling in. I think there's a lag between your typing and when it comes into my screen. How long have they been testing for this mystery illness and concluding what they have? I think the first cases, this is an interesting problem because kennel cough is not a reportable disease. A reportable disease is something that actually statutorily that the United States government or the state government says you need to report this. Anthrax, for example, would be a reportable disease. COVID in people would be a reported disease. So the reports are, I don't want to say sketchy, but in the data is not statistically valid. I guess is probably the most accurate thing to say. But the report started about August-ish 2022. About August-ish 2022. And Um, the conclusions are we don't know, and I think we know more when we look at what we know that it's not the normal pathogens, and I think you can reasonably say that it's not a I'm going to use a metaphor that I probably shouldn't. It's not one of those infections on steroids. In other words, it's not a Bordetella that mutated and is now hypervirulent. I say that because the DNA forensic testing on these PCR profiles would probably pick up a Bordetella on steroids, or a distemper on steroids, or a mycoplasma on steroids, or the like. So I don't think it's any of those that have gone crazy. But there's a score of other viruses that could be just building up their muscles and kind of doing some things. There could be a new virus that will eventually be added to that list of 33, and what I say, growing. But I don't think that the jury's out completely. And if I'm right about this kind of going through a cycle, when it dies out, hopefully when it dies out, the interest in research will I shouldn't say the interest. There'll be always interest in research, but the funding for the research is what will drive the research, and I don't know where that's really going to be at this point. Oh, Leroy's mom. That's LD. Oh, I should have guessed that. So, thank you all for joining me here today. If there's no other questions, we're going to wrap this up. I pray that your kids will never get this, and if it does come across their respiratory threshold, it'll be mild, and we can get it under control, because you've done an excellent job at keeping your kids healthy and keeping them on a long longevity track, and to make you worry-free. Thank you. Thanks for joining me here today, and I look forward to two things before I sign off. If you're still on board, anybody that's not made any comments, like, if you have any experience whatsoever, personally, or your friends or relatives or whatsoever, put those in the comments. And one preview of what might be coming in the next weeks and months ahead. As you know, I was doing live COVID things when everything went crazy in the early weeks of 2020 with COVID. I'm thinking about doing a continuing YouTube live weekly on various topics to keep up giving you guys support at home on health issues, and allowing me to answer any questions that I can get for you. So if you have any thoughts about whether you like that or you don't like that, or any thoughts about future programs, put them in the comments below, which will be I think available almost immediately when this stream ends and republishes. So check the chat one more time. I got a yes from Paula on continuing things. I appreciate that. And we'll, with that, it's me, Dr. Bay, signing off. Have a great and healthy afternoon with your four-footed family.